Welcome to this section of our breathing series. In this section, we're going to have you observe what you feel and see in each of these pieces of the breathing mechanism that we talked about in the previous section. So think about these three basic things. What does it look like if you're in front of a mirror? Do you see motion? Do you feel motion? And if you don't know what you see and feel, sometimes you can place your hands in the areas that we're talking about and try and feel what's moving or not moving with your hands. And if you're up against the surface of a chair or the floor, as you identify each of these pieces of the mechanism, what do you feel changing in what's touching the ground or the chair, so that you're actually paying attention to movement, sound, and what's touching and not touching as we move through this. So the first thing to do is find a resting position in a comfortable, safe, quiet place where there's clean air without distractions. And if you're a highly visual person, you might want to just do this sitting in front of a mirror. So again, making sure your nose is clear, because that's essential to doing this well. And then think about finding a place where there may be some live plants. Plants are our partners in oxygenation. They give off oxygen and use our carbon dioxide. And so if you have plants around you, you're going to have access to more cleaner oxygen, as well as the fact that they just hydrate areas and they make us feel more comfortable. Choose a location away from traffic or fumes. Fumes and toxic components in the air automatically trigger our brains to make us, to change our breathing to be more shallow. We want to protect ourselves from them. So it's important to stay away from fumes and toxic pollution. And then let's talk about what is a resting position. In yoga, they say, Savasana, lying down, or the cross-legged lotus position. And when you're talking about the sitting at a desk, we talk about a healthy ergonomic seating where your weight is on the bottom of your pelvis, your sit bones, your feet are flat on the floor, you have support for your lower back, your shoulders are fallen. In all of these positions, that's what you want to strive for. If you're lying on your back, your neck is supported so that your jaw can fall without any work being done. You put a bolster under your knees so that supports your low back and you don't become uncomfortable. Most people don't go into a full lotus, but if you can, it can be an extremely restful position. So then the components of that are, again, you want to relax your jaw, your limbs must be resting, your eyes are closed or have a soft focus in front of you. Your hands are loose and open, no clenching. And again, shoulders are dropped. So now we're going to track the pieces of the breathing mechanism. Now that you're comfortable, start with your nose. I want you to just, as we sit on this next slide, breathe in and breathe out. And all you do is, what do you feel in that nose? Do you have a sensation that air enters and exits both sides equally, or is one side more clogged than the other? Do you feel air as it reaches above your eyes into the upper sinuses? Do you feel it in your cheekbones? Do you feel it in the back of your neck where you have more sinus bones? Are you making any sounds as the air goes in and out? What do you hear? Then you move to your mouth. Your mouth should be relaxed, these muscles dropped. Do you feel that? Or do you clench? Are your teeth touching each other, or is there a space back there? Is your mouth actually open, or are your lips touching? What does the air feel like when you breathe in through your nose as it passes through the back of your throat? Do you have a sense of vibration or warmth or coolness or irritation, a tickle? Does it sound like anything? Then you go to your trachea. You want to feel what that air is like going through here. Do you have a sense of width in your neck or contraction? And do you feel that you're falling through your clavicle, or is it pulled in? Because that will again open up your throat. And then what's happening in these intercostals down here? As you breathe in, do you feel space between them? You might want to move fingers from one space, intercostal space, to the next with each breath so that you can tell, am I actually moving each of these pieces? Do these ones move and these ones don't? Do these ones don't move and these ones do? Just breathe and feel moving around. What's moving? What's not moving? Do you have a sense of your back if you're lying down? What does it feel like against the earth, or what you're laying against, or what you're sitting against as you breathe in? And how does that change as you breathe out? And again, what are the sounds that you hear as you breathe in and out coming from your chest and your intercostals? You go to your diaphragm, and that big dome, when you contract it, can you feel that contraction? Can you feel the pull up? Can you feel as it's tugging on everything below it? When you breathe in, can you feel everything move out, forward and backward? Can you feel the distension that should happen in your abdomen as you pull that diaphragm down? Just take a couple breaths and feel that. It should extend in a 360 all the way around your belly direction. Okay, in the next few breaths, let's just pay attention to our chest and upper back muscles. We have a lot of big muscles that these are the ones we think of as chest muscles that are on the outside of our ribs. And they can also pull out, push in, and help those intercostal muscles do their jobs. So what do you feel on an exhale? Are they actually pulling towards your spine? On a inhale, are they resting and moving outward? How do you feel? What do they feel like when you move against the floor or your seat, or if you have your hands on them against your hands? Are they pushing and pulling in their movement? Okay, so just like your upper chest muscles, your abdominal muscles, and your lower back muscles, the ones we exercise when we do push-ups and pull-ups, sit-ups, we can contract them, and in that contraction, push air up and out. And when we relax them, pull air, let air come in, or else work them and pull more air in. And they can expand outwards in a 360-degree way, and they can go downwards towards the floor, towards the belly, and you can feel them working just like you would those upper chest and back muscles. And then you have pelvic floor muscles that also work, and those are the muscles that really support all the internal organs of the abdomen. They maintain firmness in abdominal structure from below. And we can identify those muscles with the action of acting like we're going to stop and start our urine. And they pull up, or they opened up and relax. You can feel them doing that when you urinate or stop your urine, but you can also use that same motion to help pull those abdominal muscles down and out, or push them up and out.